Welcome to Beyond Hormones, the Business of Wellness, the podcast for hormone and functional medicine providers who want a thriving, predictably profitable practice and maybe a little less stress along the way. Hi, I'm your host, Jody Lane, and I've worked with lots of clinics in marketing, sales, and business development, and I have seen what works and what doesn't. And here's what I believe. Hormone and wellness care should be available to everyone who wants it. And while providers know the medicine, many struggle with the business side of their cash practice. And that's where I come in. See, this podcast is here to share real strategies, real stories, things you can implement in your practice right away. So I am so glad you're here. Come on, let's go. Hey everybody, welcome back to the Beyond Hormones podcast. I'm Jody, and this is the show where hormone and functional medicine clinic owners come to talk real business strategy. I mean, things that actually work inside a cash pay practice. And if you've been around for a while, you know today is a Thursday Fiver, and this one I want you to listen to 2 times. First for yourself, and then listen to it again thinking about the providers on your team, because what we're going to talk about today is one of the most common, most costly mistakes that I see happening in hormone clinic consult rooms. And it's costing clinics patients they should be keeping. All right, let's get into it. Here's the question I want you to sit with. When a provider finishes a consultation and a patient doesn't move forward, what actually went wrong? Most clinic owners I work with would assume the answer is price. The patient thought it was too expensive. And you know what? There are times when that's true. But a lot of the time, more than we want to admit, the patient didn't say no to the price. They said no to the uncertainty they felt in that room. And that uncertainty, it came from the provider. Now, here's what I mean. I was working in a clinic a while back. The clinical care was genuinely excellent. Skilled providers, patients were getting great outcomes, but their conversion rate was starting to suffer. So they asked me to listen in to see how the consults were flowing. And the problem became obvious really fast. The provider would get to the end of the consult and start pulling back. You know, we have a few different options we could try, they would say. Or I'm not sure what your budget looks like, but there are some different levels you can buy. Or this is one approach, but there are others if you feel this is just too much. Every single one of those sentences was the provider's own discomfort about price leaking into the room. They weren't bad providers. They weren't even doing it on purpose. They were trying to be considerate, not to be too pushy, not to make the patient feel pressured, which I respect. What the patient was actually hearing was, even my doctor isn't sure if this is worth it. And that is the moment that momentum dies in a consultation. So let me give you the reframe that will change everything. And I want you to listen and then take this back to your team. As a provider, you have one job in the consult room, just one. Your job is to look at the patient in front of you, understand their goals, understand what's going on in their body, and then make the best recommendation you can for what they need to do to feel their best and live their most vital life. That is it. That's the whole job. The moment you start mentally calculating whether they can afford it, whether they'll say yes, whether the price feels like a lot, you are no longer being a provider. You have crossed into the salesperson territory. And that's not your lane. That's not what the patient came to you for. And frankly, it's not what you're best at. So here's the thing about price judgment that most providers don't realize or even think about, which is why this podcast is so important. When you act that way, patients can feel it. You don't have to say anything. It shows up in how you soften your recommendation. It shows up in the options that you offer instead of the plan that you truly believe in. It shows up in the energy shift when money comes into the conversation. Do you ever notice when money comes up, maybe you start to stutter or get a little tongue-tied? And when patients feel that hesitation from you, they mirror it right back. Now they're questioning whether it's worth it too, not because of the price and not because they don't believe what you have to say is going to happen, but because you told them non-verbally that maybe they're wrong and it's not. And that's exactly why I coach clinics to separate the care conversation from the cost conversation completely, and to have a dedicated patient liaison or patient coordinator just handle the pricing conversation. It's not just a workflow presence, it's a protection strategy for you and your providers and your patients. Because when providers aren't in the business of discussing price, they stay in their lane. They stay focused on the clinical picture. They make clean, confident recommendations based purely on what the patient needs, not what they think the patient can spend. And that confidence is what creates belief in the treatment plan. Your coordinator will then take that belief, that momentum, and carry it into the financial conversation because they're trained to do that. They can handle objections. They can walk people through payment options. They can do it in a way that is not the person who examined the patient. The separation protects the trust you and your providers built with the patient. It keeps the relationships clean. For all you longtime listeners, you know how much I love supporting hormone clinics to become the best version that you can be. So if you don't mind, I want to stop and share for just a quick minute about a product of ours that I think can make a real impact for you. And it's called Practice Automation System. Now, here's something most clinic owners I've spoken to never realize. They think their marketing doesn't work, when the truth is most clinics are often wasting up to 75% of their marketing budget without even knowing it. Not because their marketing is bad, no. It's because of what happens after the lead comes into the clinic. Now, according to studies, 87% of people don't answer calls from unknown phone numbers anymore. Can you believe that? I know I didn't know the number was that high. So when your office calls back a lead and the lead doesn't pick up the phone and you don't follow back after that, the money you spent to get that lead is gone. Look, the Practice Automation System is what we built to fix this problem. The moment a lead comes in, the system texts them in 5 minutes. It sends nurturing emails for weeks if they're not ready. It helps them move through a sales pipeline your team can actually keep up with. We built the foundation for this inside an actual hormone clinic, the one I worked at, the one I helped to scale to over $4 million in revenue. So every campaign tactic, every text, and every email language and timing was tested on real hormone patients before it ever became a product. For most clinics, as few as 4 patients a year covers the cost of the entire system. To find out if Practice Automation System is right for your clinic, go to acceleratedmedicalpractices.com/automation. That's acceleratedmedicalpractices.com/automation. All right, guys, now let's get back to what we were talking about. Now, and this is the part I really don't want you to skip, because here's what happens when price doesn't come up in the consult, but the recommendation isn't documented. Let's say the patient genuinely can't move forward that day for whatever reason. Maybe they need to talk to their spouse. Maybe cash is just tight that month. It doesn't matter. Whatever the reason, they leave and they don't move forward. If you or your providers make a recommendation and it's not documented in your EMR, in your visit note, in your CRM system, that recommendation just disappears. No one is going to remember it. No one's going to follow up on it. Nobody says to that patient 3 months later, hey, Dr. Smith recommended that you do the gains wave and you weren't able to do it that day. Has anything changed? No, instead, the patient just falls through the cracks. And so does the revenue that was supposed to support your clinic. But if it is documented, your coordinator can pick up on it. Your patient success team can bring it back to life at the right moment. You serve that patient when they're ready, instead of you having to start all the way back from scratch in the appointment. So please document every recommendation you do, every single one, not just the ones that bought and converted that day. All right, let me bring this together with your 3 major takeaways. Number 1, a provider's job is to make the best recommendation for the patient, full stop. The moment price enters a provider's thinking, it clouds the clinical picture. So train your team and yourself to remove cost from the consult equation entirely. 2, separate the care conversation from the cost conversation intentionally. I'm not talking about just doing it because it's a good practice. No, it protects your providers and it protects the patient relationship and it protects your conversion rate. Your coordinator is your closer. Let him close. 3, document every recommendation. If the patient doesn't convert that day, make sure to document the recommendation so that somebody can follow up with it in the future. And if you've got providers on your team who are not doing any of these things in consults, they're softening their recommendations because they're worried about price, then this episode is for them. Share the episode. Have it in a lunch and learn. Listen to it together while you're eating. Make it part of the training because this single mindset shift can change the outcome of every consult that they and you walk through. All right, I hope that you enjoyed today's Thursday Fiver. And of course, as always, our Thursday episodes come from courses that are inside the accelerator. So if you want to dig a little bit deeper about the provider's role in the sales process, go on over to the accelerator, sign up for your free account at accelerator.acceleratedmedicalpractices.com, and you can go find the course in there. When you go in, there's a lot of free courses that you can take advantage of. You can purchase courses as needed, or as a lot of providers do, you could buy the Power Pass, which is $99 a month, and you get access to everything. All right. I am so grateful to have the opportunity to share this information with you. I've seen this in my own clinic in Orlando. We've worked through these issues. I've worked with lots of clinicians along the way in my consulting career. And I'm telling you, when the shift occurs, when you remove the thought of price out of your mind when you're dealing with a patient in a clinical setting, the entire environment changes and it's worth it for your patient. All right, thanks for listening. Thank you for listening to Beyond Hormones, the business of wellness. I hope that you're walking away with fresh ideas and real strategies you can use to grow your practice with profit and purpose. If you enjoyed today's episode, be sure to follow the show so you never miss a conversation. And if something you heard today resonated with you, do me a favor, share this episode with a friend or a colleague. It's one of the best ways you can support the show, and it might be exactly what they need to hear right now. If you want even more tools and support, go ahead and head over to acceleratedmedicalpractices.com. Until next time, keep doing the work that matters. Your patients need you, and I am cheering you along every step of the way.